Welcome to week 5. Wow, time is really flowing fast. Instead of flying fast, I have now come to think of time that it just evaporates. It's like, wow, we're already over the halfway point of September. It's just, but anyway, lots to learn. And you may remember that last week we talked about the musculoskeletal system, but in your coursework and your textbook, last week you read about the skeletal system, and this week you're reading about the muscular system, which I already covered last week. So I have new stuff for you, which I think is very fascinating. Now we're going to, instead of just the names of the muscles, we're going to talk about what the muscles actually do. Now, you may feel that this is a reinforcement of what you learned in anatomy and physiology, which truthfully is good, because we all know that when you came out of anatomy and physiology, maybe you didn't retain everything. But that's the thing about medical terminology class and anatomy and physiology class, is they kind of overlap because you need to know the names of things in order to know what the anatomical sites are. So now we're going to talk about the function. What exactly do all of those 660 plus muscles in the human body, what are they doing? Okay, so let's talk about that. Now, I have some new factoids from what I told you about last week. And that I don't know if you know this, but muscle on the regular human body, muscles make up approximately 40% of total weight. And the reason why I emphasize the normal, usual body is, you know, they have those muscle builders where they have like no fat and they're all muscles, and you can almost do an anatomy class right on those guys. I don't really find that attractive, but okay, some people do. All right. The heart muscle. Now, you remember we talked about the heart and what it does back when we did cardiovascular. But it's interesting that you need to understand that the heart has the heart muscle, the cardiomyo, around it, and that plus your nervous system. So the nervous system tells the muscle of the heart to contract, and that's how it pumps the blood out of the heart and into the arteries to go traveling all the way through the body. And then you know, it comes back via the veins. And you remember all of that, right? Of course you do. Absolutely. All right. The gluteus maximus is the body's largest muscle, and this is not a personal reference to anybody's butt. It's just what it is, okay? The largest muscle, and that makes sense because when we're sitting, right, it has to support the majority of the weight of the body, so that's an important function. The ear. Remember last week we talked about the smallest bones in the human body are in the middle ear. Well, there are also muscles that hold the inner ear together and connect through the middle ear to the eardrum. Teeny tiny muscles, of course, because that's a small space. All right, and the masseter muscle, which is here. This is what works your jaw. And you might know, I don't know if you ever watch the Nature Channel, they'll always talk about like tigers and lions and their jaw power, which is like 200, 300 pounds. But we can close our teeth, close our jaw with as much as 55 pounds in your incisors, which is where that's in the front where you bite, and up to 200 pounds on your molars. Those are your chewing teeth in the back. That's pretty interesting, don't you think? We may not compare with a lion or an antelope, but we get the job done. Especially give me a cheeseburger. I'll show you 200 pounds of molars. Okay. All right. Now let's talk about the functions of the muscles. And we have 11 of them. So I thought it would be interesting to go through them so that you understand. I think when you understand what things do and how they work, it helps you remember and really identify with what's going on here. Okay. So you know that when muscles contract, they contribute to gross meaning large, and not gross as in disgusting, but gross as in large, and fine as in more delicate movements. Okay. So gross movements refer to large, as I said, coordinated motions like walking, okay, running, swimming. I don't run, but I do walk and I do swim. Any of you run? No, me neither. I won't even run to my car. No, that's not happening. All right. Now, fine, more delicate movements are like writing. Now, did you think about that? Do you think about the muscles that are involved in writing? Remember, your hands have about 25% of all the bones in your entire body, and there are muscles that make them move like this, which includes holding a pen, and we can take it a step further, and it includes typing on a keyboard too. Okay, you can't do that without muscle function. Speaking, the muscles in my tongue, as well as in my jaw and my mouth, and let's not forget the larynx. They all have to work together to produce sound. And facial expressions. Are you kidding me? Oh, okay. And smiling. Smiling is good, right? Let me see smiling. Come on. Yes, thank you very much. Okay. All right. Most of the muscle movement of all of these 6,000-7,000 of muscles that are in the human body are conscious control. And that means you may not hear yourself, but there's a part of your brain that's saying, move your hand out, move your hand up, open your fingers, close your finger. That's all conscious. Okay. Your body's not doing that on its own. But then you do have what are known as reflective movements, which is as you're getting closer to a frying pan, you can feel the heat. That's your sense of touch, right? And your muscles don't need you to say, pull that away so you don't burn yourself. It does it, okay? Reflexes. I don't know if you've ever, I'm trying to remember if my doctor even, I think the doctors do that. You know, where you bend your knee and they take the little hammer and they bang on your knee to see if that's a reflexive action, okay? If you've ever watched a medical show on television and someone has had spinal injury, what they will do is they will run an instrument along the sole of the foot to see if there is any reflective action to tell whether there is nerve connection. Because remember, your whole entire body works in harmony with each other, with the other parts. And we may have 14 different body systems, but the fact of the matter is that they all need to work together or something's not good. Okay. So the nerve tells the muscle, the brain, which is the controlling factor of the nervous system, tells the muscle to do whatever it needs to do. Okay. So it's good that it works on its own, though. I'm just saying, and we talked about this last week, right? If you had to sit here and tell your heart, beat, 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 You never get anything else done. Okay. All right. So let's talk about stability. The muscles and the muscle tendons stretch over your joints, shoulder joints, knee joints, of course, elbow joints. Okay. And these are kind of like tethers to create the stability so that you have that control and your elbow is not going and your shoulder's not going all over by yourself. Okay. You need to have that control. And that comes from your nervous system telling the muscle system, don't go all wacky nacky. You got to be smooth. Okay. Shoulder, knee, elbow, you know, the joints, not that joint, even though it's now legal in a lot of states. I'm not talking about that. Okay. Core muscles. I don't know if any of you have ever been to an exercise class. You already know about the core muscles in your abdomen. My core muscles have been on vacation for quite some time. Okay. But remember, you have to get your core strengthen. Your back muscles, of course, are very, very important. And then your pelvis. And, you know, just about a month ago was the anniversary of when Elvis Presley passed away. And you may be old enough or know somebody who's old enough to remember that Elvis Presley used to be called Elvis the Pelvis because he had very flexible muscles in that area of his body. I'm not going to get up and show you because that could be considered sexual harassment. And no. Okay. So remember that your muscles are the tethers. They keep things connected. They keep things under control, such as lifting weights, something else I don't do. Okay, but you might, or you might know somebody who does. So now you can tell them, well, thank your muscles. Okay. Posture. Oh my gosh. I'm constantly hearing my mother in my ear. Sit up straight. Sit up straight, sit up straight. So those are the skeletal muscles that help us align our spines properly and make sure that the shoulders and everything is in alignment. And why is it important? Not only to keep your mother happy, that's really not the main function. The main function is because when you have good posture, and your body is aligned, that literally helps your feet, your ankles, your legs to function longer and properly. Okay. And if any of you have ever had problems with your feet or know people who have problems with their feet, you will know that it has a huge impact on somebody's quality of life if they can't walk or they can't walk well. Okay, so it's very, very important. And it starts here with your shoulder position and of course your head position. And you also don't want to get kyphosis when you're older, which is dowager's hump. Okay, it's all a thing, but that's all your muscles that are either being trained to do their job properly or ignored, and they don't like to be ignored. You know what happens if they're ignored. Yeah, that's okay. Moving on now, circulation. Now, we talked a little before about how the heart muscle is the functioning power. It's the motor that pushes the heart, the atrium pushes to push the blood through to the ventricles. Remember this? And then the ventricles push through to go out through the arteries. And that, of course, they're told to do that by the nervous system. Okay, so the smooth muscles, additionally, the heart muscle, each of your arteries and your veins have muscles in the walls that continue to push things through. And they are primarily affected in a negative way if the body becomes dehydrated or there's exsanguination. Exsanguination, okay, if you watch Law and Order or any of those, you know exsanguination is blood loss. Well, excessive blood loss, okay? So your body needs that moisture to keep the muscles lubricated so they can continue to do their job, right? Okay. And so the muscles expand when blood flow needs to increase, like when you're exercising, okay? And they will close down to decrease. But remember that when you are limiting the blood flow, that has a part of a function in the human body, but it cannot continue, which is why everybody is always, you know, on you, or somebody, especially when people get over the age of 50, about the cholesterol issue. Why? Because the cholesterol is gunk that lines the arteries and the veins, and that narrows the flow of blood, which then causes problems, okay? Because remember, blood carries the oxygen, which is the food for every cell in the body, okay? So you see how it all connects. And I think most people don't think of muscles when they're thinking about arteries and veins, but yet there they are. Okay. Harmony, respiration. Did you know you can't breathe without muscles? Of course not. Because first of all, your diaphragm is down here. And if you've ever been literally taught how to breathe properly, if you sing, okay, or my allergist is the one who taught me how to breathe through your diaphragm, not your chest, okay? So the diaphragm is dome shaped, and you've seen this on the illustrations. It's shaped like that, and it sits right below the lungs. So when the diaphragm contracts, which means it becomes a little more concave, it makes room for the lungs to expand, oxygen in, okay? When the diaphragm relaxes, it goes back to its dome shape, which then presses upon the lungs to squeeze out the air, expiration. It's all happening right here, ladies and gentlemen. You thought the lungs were all in charge of that, but no, it's the muscle, it's the diaphragm. Okay, so it's important that, again, here we have the muscles working to help with respiration, which is a whole nother body system. Okay. Any questions so far? Okay. All right. I know some of you know most of this already, and that's a good thing, is repetition. Remember, I've told you this, repetition is really going to get it to stick in the brain. And then when you're sitting in some meeting in the hospital where you work or the doctor's office, and you're going to say, oh, and they're going to say, wow, you're smart. All right. So now let's talk about muscles and the digestive process. Okay. Well, we talked about, did we? All right. I don't remember. We have a lot yet to go, but all right. The gastrointestinal process. Okay. So gastro is the esophagus up to the stomach, gastro, and then intestines are your small intestines and your large intestines. And you have your whole process from mouth to anus where the food travels. Okay. Well, it's peristalsis that gets the food to travel. So we start up here with the smooth muscles that are involved in you swallowing, right? You chew, and then you swallow. And then peristalsis the muscles keep going to push the food down the esophagus into the stomach, right? And then the stomach does its thing, and then the muscles in the stomach contract to move it down into the small intestine, and then the muscles keep it going through the large intestine, and that's all that's happening is this wave-like motion of the muscles of your digestive tract pushing, pushing, pushing until you push out the residue. Okay. Who would think we have to thank the muscle system for proper digestion? But it's true. Although these are muscles that you can't really, although maybe when you eat, you exercise these muscles. So although every nutritionist on the planet is going to tell you this is not the way to exercise your muscles, eat, eat, eat. Okay. But then we have to exercise the other muscles because otherwise we get too much adipose and it's a whole thing. You see what I'm saying about how all of these body systems work together? Thank you very much. I'm exercising one set of muscles and then the adipose comes. So now I have to exercise other muscles to burn calories so I can get rid of the adipose, but that's going to make me hungry. It's a vicious cycle. All right. So now let's pee. Urination. Oh, how many muscles are involved? And remember, do you remember we talked about sphincters? Sphincters are circular muscles that there are about, I want to say 36 in the human body, but don't quote me on that because I may not be remembering. There are a lot of sphincters. Your anus is a sphincter. Okay. Remember, we talked about this when we talked about the urinary system, the sphincter at the bottom of the bladder, as well as the sphincter at the exterior part of the urethra, which is what you hold as you're running to the bathroom, right? Okay. So there are also muscles involved, not only in the bladder, but the kidneys, the penis or the vagina, depending upon your persuasion, the prostate, which goes with the penis, not the vagina, the ureters, remember those are the tubes that come from each kidney into the bladder, and the urethra, which goes from the bladder to the outside of the body. And all of that, the process of mictration, which is the official term for urination, all involves muscles, muscles, muscles. Okay. Childbirth, any woman who has had a baby, who has given birth to a baby, is fully knowledgeable in the muscles that are involved in childbirth. This is what we call the contractions, are really the muscles in the walls of the uterus that say, okay, kid, time to leave. Okay, so the contractions, as you know they are called, that's the muscles contracting to push the baby through the vagina, and the pelvic floor muscles, which you also need to exercise to keep bladder control, is what helps guide the baby's head down the birth canal, also known as the vagina. And this is also why, and you may know some women, or you may be a woman yourself after childbirth that has had problems with involuntary urination. And that's because the baby kind of stretched out the pelvic floor muscles, because those are also involved in that whole process. Okay, so you have to do, that's your Kegel exercises. The women probably know about Kegel exercises, which is you contract and release, you contract and release consciously those muscles to keep them. Remember, muscles are like rubber bands. If you just throw a rubber band in a drawer, and come back to it years later, which, trust me, I have found years old rubber bands in drawers, and if you try it and use it, it basically disintegrates, right? It cannot function. Muscles, just like rubber bands, need to be exercised to keep them in shape. So hopefully that'll help you understand a little bit more about the process. And vision. The skeletal muscles around the eye, which control the eye movements. These are the busiest. Remember, we talked about this last week. These are the busiest muscles in the entire human body because they are constantly moving. Okay. Even when you're sleeping, and you know this, right? Because you can look at somebody who's sleeping, their eyes are closed, and you can see their eye movements underneath their eyelids. Okay. Organ protection. The muscles in your torso in particular are there to not only protect your internal organs, such as your lungs and your heart, your kidneys, right? If you've ever heard, and I am not a fan of boxing, okay? I know a lot of people think it's an elegant sport. I just can't watch it. But the fact of the matter is you may have heard the term kidney punch, which is back here where you can actually punch through the muscle protection because it's not necessarily very strong in your lower back, right below your lumbar, and actually damage the kidney. Okay. The muscles are there to protect the organs as well as the skeletal aspects. Okay. So muscles are there to protect the ribs as well by absorbing shock. So it's kind of like a floating floor, if you will, that can reduce the opportunity of fracture and then, of course, of further injury inside. And last but not least, temperature regulation. It's interesting, right, to think about, and remember when we did the integumentary system, we know that the skin is responsible for temperature regulation, which is why you sweat when your body gets too hot. Okay, well, the muscular system is involved in that as well, because you might know that when you're cold, you start to shiver. That's your muscles shaking to try and generate heat from movement. Isn't that fascinating? Are you fascinated? Just okay. All right. So this again is every body system working hand in hand with all the other body systems. And it's also one of the reasons why I am truly amazed that our healthcare professionals can even diagnose anything, because there are so many systems and so many things involved. And as you mature in your healthcare education, you will start to learn, and maybe you did a little bit in anatomy and pathology, signs and symptoms of diseases and conditions. And this is all part of that. Okay, so it's incredibly complex to determine that's what you have. And that's also a reason why we are so fortunate that they continue to innovate in diagnostic testing so that can help pinpoint and kind of separate out, okay, well, we know the bone is not broken, skeletal system, check. Okay, the muscles are intact, skeletal system, check. Now we can look at the integumentary system or one of the other systems. But this is what fascinates me about healthcare is It's always a puzzle to be solved, and nothing is as simple as you think it can be. So as you continue to learn and build your knowledge, okay, you not only become a more accurate and functional member of the healthcare profession, but you also become a much better patient or loved one of a patient, because now you understand, oh, yes, we have to tell the doctor about that sign or that symptom. Boy, that has nothing to do with anything, but it may. Got to give them all the information and let the physician parse it all out. Okay. What am I going to tell you? Review this often. Review this often. Don't sit down, try and memorize, because that's temporary. Use your medical dictionary. If you don't know what something is, look it up, and then you'll know, and you'll be accurate, okay? And please, please, please query when necessary. Remember, the word query means to ask, and I want you to ask me. Send me an email. I promise you a response within 24 hours, okay? Any questions now? So much information. Okay, well then, email me when you do. I'll be posting the recording in a little bit. Thanks for coming and keeping me company, and have a great day.